All right, well, thank you to Sages for the honor of the podium. Thank you to the chairs for the invitation. And thanks to all of you for coming to this session. I was in your seats not too long ago. I graduated from MIS Fellowship in 2017. And choosing where to work and being part of an integrated healthcare system was a very important part of my decision on where to launch my career. I have no industry disclosures other than as part of this talk, my residency training was at Kaiser Permanente in Los Angeles for general surgery. I did my MIS fellowship at the Veteran Affairs Hospital in Palo Alto, and now I work at the Kaiser Permanente Mid-Atlantic States in the DC metro area. My practice is largely robotic hernia practice. And in contrast to Dr. Liu, I get about 5 to 8 days on the robot a month. So I think we may see the system a little bit differently. As part of that disclosure, I get that because I started the robotic general surgery program in Northern Virginia and helped build the abdominal wall reconstruction program in the region. So the World Health Organization defines integrated healthcare systems as an organization and management of health services so that people get the care they need when they need it in ways that are user-friendly, achieve desired results, and provide value for money. This may best be described as people getting the right care at the right time, and the focus on this really serves in contrast to the fragmented healthcare delivery system. Often, when people think of the patient just right in front of them, and often a specialist or subspecialist treats that patient for the disease in their specialty. An integrated healthcare system is a system charged with taking care of a population or a community. And so not only is that patient with biliary colic in front of you important, but so is their cousin who also has maybe debilitating pain, but does not have access to healthcare to come see you, so can only wait until they have an acute attack and go to the emergency room. Their care is just as important, and this system helps provide care for the entire community, which is why affordability and access is such an important part of integrated systems. These are the pillars. Capitation, which is prepaid healthcare, collaboration, integration, preventative care, quality and safety, and affordability. There are many examples of integrated care in the United States, like Mayo Health Systems, Geisinger Health, and the Veteran Affairs Hospital. Probably the best known system is Kaiser Permanente. We serve over 12 million members in these 8 states, plus Washington, D.C. And it comprises of 3 entities: Kaiser Foundation Health Plan, which is the insurance company; Kaiser Hospitals, which is the facilities in which we practice in; and Permanente, which is the medical group, which has over 23,000 physicians, with me being one of them, make up Kaiser Permanente. So capitation can best be described as the opposite of fee-for-service. For the patient, this means that you pay a set fee per month for the care you receive in that system. Whether that you don't get sick at all or you get really, really sick and need a lot of care, you pay the same amount, which is great for planning for those families in terms of healthcare budgeting. There's minimal out-of-network and hidden fees. What that means for you as a provider is that you get a salary based on a fixed 40-hour work week. And whether you do 5 operations in a year or 500, you are charged with doing the best care and providing the best services for that patient. There's minimal billing and coding in this setting because for example, if I want to do a abdominal wall reconstruction with Botox, I don't have to ask the insurance company to pay for Botox. I think that's the best operation for the patient, and Kaiser is the insurance company, so that patient gets Botox for the abdominal wall reconstruction. I don't have to code for the myocutaneous or myofascial code because I get to, do a TAR and get paid the same amount if it was a just a regular incisional hernia repair. So really there is this trust between the system and the patient, and also the system and the physician to provide the best care. Collaboration. Not only are you entrusted with this, but also so is everyone else in the network. So for example, a couple years ago in the Mid-Atlantic states, we started an official surgical prehabilitation program. The idea is that it's a team who are mutually responsible for the outcomes of the patient and not individual superstars like the surgeon. So for example, in prehabilitation, the primary care doctor who gets the patient to stop smoking, and the wellness coach who gets the patient to lose 30 to 50 pounds, and obviously the surgeon who does obviously the technically perfect operation, all get the same credit for the patient having a really good outcome from their hernia surgery. Not only that, every patient who comes through our ambulatory surgery clinic gets a phone call from a nurse within 24 hours to check on them, answer questions, prevent unnecessary trips back to the ER. Every patient who comes into the hospital gets a case manager assigned automatically to facilitate a safe discharge. And these are some great benefits of an integrated healthcare system. And how do we do this? Through Epic. It's a fully integrated, inpatient, outpatient electronic medical record system, which I'm sure you guys are all aware of. So imagine every lab value, every blood pressure ever taken, and also every operative note ever written being right at your fingertips. You don't have to spend time looking for that operative note or that CT scan from another hospital. It's right there, you click on it, and your time is actually spent just taking care of the patient in front of you and on clinical care that you were trained to do. Integration is both horizontal and vertical. What horizontal integration means is that you can take your 6-month-old in for their wellness check to a Kaiser Permanente building with a pediatrician. At the same time, you can get your COVID shot, you can go down to the lab, get the lab drawn that your primary care doctor was bugging you about, and then go to the pharmacy to pick up medications for your mom and be out of there. That's horizontal integration, one-stop shop for all your services. What is vertical integration? It means that primary, secondary, and tertiary care is in a seamless workflow for optimal access to the patient. So your general surgeon, this group of primary care doctors, refers every biliary colic patient to you. All right, the patient turns out that they have a choledochocyst instead. So, you want to refer to a hepatobiliary surgeon. Well, you don't have to call around town to see who will take care of this patient. There's already a hepatobiliary surgeon at a tertiary hospital. If you're a subspecialist like me doing abdominal wall reconstruction, I do zero marketing, and my clinic is filled with complex hernia patients because I have, a catchment of 350 patients in Northern Virginia and get referred every complex hernia patient. Here's the preventative care is a very important part of our system because, again, it's about population health. So, what good is it to do a technically perfect colon resection on a late-stage colon cancer when that patient was 7 years late in their screening colonoscopy? These are our national Kaiser screening statistics for breast cancer, cervical cancer, and colon cancer. The dark blue is the national Kaiser Permanente screening percentage versus the national percentage. And you can see it's higher in every measure. How does this translate? This is a paper published just earlier this year on life expectancy in Kaiser Permanente members in the Mid-Atlantic region compared to national CDC data from 2014 to 2017. Depending on the demographic, Kaiser Permanente members have an extra 3.5-year life expectancy compared to CDC data. Quality and safety, which is important to all of us in our practice. And I could sit here and talk about HEDIS measures and leapfrog measures and how many hospitals are in the top hospitals in the United States. But what this ultimately boils down to is healthcare equity and how do we ultimately serve those underserved populations. And we heard about this many times through this conference. But when the demographic of the patient best matches the demographic of the provider, patients get better care. We know that 40% of physicians in practice are women, and a little over 50% of graduating medical students are women. Here is the breakdown for our medical group in Kaiser Mid-Atlantic. We are 61% female among the medical group. This is the demographic breakdown for MapMG, which is 33% Caucasian, 35% Asian, and 24% African American. And we know that this makes a difference to quality of care to have a diverse physician group. And this is the breakdown on the second languages that our physicians speak, including 19% Spanish. So this is our value equation. I just want to do a quick poll. So, including the speakers maybe. Raise your hand if you've ever done or seen a lap appy. Okay, okay, everyone. So keep your hand up if you take the base of the appendix with a tissue load stapler. Keep your hand up if you take the mesoappendix with a vascular load stapler. Okay. Now, raise your hand if you take the mesoappendix with a ligature as your standard practice. Okay, now raise your hand if you know the difference between the cost of a vascular load stapler and a ligature. Okay, so I see many hands in the room, which is great. Depending on the hospital contract, it's about $300. A ligature is about $450, and vascular, each staple load is about $150. And so, and I guess for those of you who use the ligature and know the cost, raise your hand if you think this makes a clinical difference. Okay, fair enough. So I think this, affordability goes to talk about, imagine that $300 difference for one decision on a common case across all surgeons, day after day, year after year. As we know, the healthcare system in the United States is one of the most expensive and least effective in the developed world. And for us, we are all part of that system. Decisions we make every day impact the cost and also the outcomes. So in an integrated healthcare system, those decisions are made on a system level to try to make the care affordable so that that patient who has no access to care, we can lower the cost so everyone can have better access to care. And I put this here because this is a system that I'm proud of. This is where I want my loved ones to get their care. And so it's a privilege to work for a system that serves a purpose to serve the community. This is my last slide, but what does this look for you? Minimal billing and coding, a fully integrated electronic medical record system, a pre-built referral base, so no marketing, a network of physicians who can be your mentors and coaches and your allies as you start your careers or continue your careers, stability in crisis. No one got a pay cut during the COVID crisis, and because we weren't productivity based. So equity in terms of patient care and between different demographics and underserved populations, and also equity in terms of your pay. Women and men get paid equal work for, or equal pay for equal work, which I think is pretty awesome. And path to leadership. So every leader in the Permanente medical group is a physician. And so you know that these decisions are made by other physicians who started as frontline doctors just like you. So it is much easier to go to another doctor and say, hey, can I get support to start this prehabilitation program, than it is to an administrator, because they understand the ins and outs of clinical practice. So today I am the APIC for perioperative services, which means I help support the surgical operations in Northern Virginia, and and this organization has definitely helped me support patients, not just the ones in front of me, through my administrative role. So thank you.